I feel like the Oklahoma City community has turned the corner. I feel like there's some positive momentum in health. It's something that we're prioritizing after so many years of neglect. As mayor, it's one of my top priorities.
A decade ago, Mayor Mick Cornett placed Oklahoma City on a diet, challenging us to lose 1 million pounds and begin to create an awareness of the flawed built environment that was not conducive to a healthy lifestyle. Through his campaign, he asked the public to vote for capital improvements that would drastically enhance downtown Oklahoma City for the better.
We have now redesigned all of our downtown streets to be more pedestrian friendly. They've been narrowed, they've been more heavily landscaped.
Plus adding miles of jogging and biking trails throughout the area for everyone to enjoy. On top of working to make the heart of OKC more active, Mayor Cornett now requires developers to build sidewalks as part of neighborhoods, a mandate that has been sorely needed for years. Additionally, we are building senior health and wellness centers, with the first one opening this year.
Because we're trying to get ahead of the demographic shifts that show the baby boom generation is going to be aging into a situation where they're going to have wellness needs that have far exceeded cities' capacities to provide those services in the past.
In our work to build a culture of health, several community organizations band together to address social determinants of health and disparities. Through public-private partnerships, the 54-acre Northeast Regional Health and Wellness Campus was built to provide access to low-cost, integrated primary care, public health, mental health, and social services, and serve as a one-stop shop in one of the city's zip codes with poor health outcomes.
Well, I enrolled in the free My Heart program and spoke with my community health worker because I had low income, no insurance, and I was trying to get my hypertension under control. The thing about it, they had a lot of things that were available for me, and with low income, they were still able to help me out with my prescriptions and things that I needed.
My job is to assist, advise, and connect these individuals and families with community resources that are best to suit their needs.
Things like tobacco prevention, mental health care, and teenage pregnancy prevention education. The Oklahoma County teen birth rate is one of the highest in the country, ringing in at 70% more than the national average. But thanks to a local coalition and their efforts, we're starting to see a shift.
And in the first 2 years, we have already been able to reduce the teen birth rate by 27%, which is almost our goal of 1/3, which would be 33%. So it may be that we achieve our goal in much shorter time period.
Community leaders and members have worked to create a safe space for individuals to come together and create a dialogue surrounding one of today's most controversial subjects, race. Most recently, a faith-based organization called Stronger Together OKC hosted a dinner with chiefs of police, city leaders, and prominent African-American community members. Leaders that can pave the way for Oklahoma City.
One of the black leaders in the community began to share his story. And a couple of the other leaders that were there had known him for 15 or 20 years. And when he shared his story, it really impacted these other two because they both said, I've known you for 10 or 20 years, but I never knew your story. I never knew that you were living in Tennessee when Dr. Martin Luther King was killed. We never knew how much this conversation impacted you personally, yet they had sat at the table together for years.
And it finally feels like we're starting to make a dent in some of these social issues and health issues that have plagued Oklahomans for years.